Next, we have Ms. Cinthuja Pathmanathan. She is a lecturer in physiotherapy in the Department of Allied Health Sciences at the Faculty of Medicine, University of Colombo. She graduated from University of Peradeniya, Sri Lanka, with her Bachelor's of Science in Physiotherapy and completed her Master of Research in University of Dundee in UK. She has been continually engaged in clinical gait analysis and motion capturing, developing spinal orthosis for scoliosis patients, cost-effective external fixator design, and diabetic foot care solution development are some of her translational research engagements at the Center for Biomedical Innovation. She continues to be a diverse personality who brings in innovative clinical analysis and inputs to the multidisciplinary biomedical engineering projects. So for a country like Sri Lanka, it's important to have options in the place of sophisticated sensors. So Ms. Pathmanathan will speak on gait analysis and medical treatments in Sri Lanka without sophisticated sensors. Over to you, Ms. Pathmanathan.
Thank you. Let me share the screen. Thank you. Good afternoon, everybody. First, I would like to thank organizing committee for having me in this session. Today, I will be talking on gait analysis and medical treatments in Sri Lanka without sophisticated sensors. So as we all know that movement disorders and the locomotion or impaired locomotion and the gait is widely seen worldwide due to many conditions, including injuries, musculoskeletal injuries, and neurological conditions, and so on. So therefore, it's very important to have a correct diagnosis of the motor disorders to plan effective treatment for the patients. So in a common clinical setting, the clinical reasoning is widely used by clinicians. So it is, in a simple term, is the process by which clinicians collect, process, and interpret the patient information to develop a management plan. For the clinical reasoning, the clinician should have adequate knowledge and skills and the level of experience. So these three play a critical role in the clinical reasoning process. So this diagram shows how the steps in the clinical reasoning. But if I focus on this data collection part, that can be elaborated using this flow chart. So initially, when someone's come with motor disorders or movement-related disorders, initially the clinician will do the subjective interview, where clinician will collect the data or collect the information from the patients by talking to the patient. So that will help the clinician to form hypotheses or the differential diagnosis. That again confirmed by general screening. So the general screening include mainly the physical examination as well as outcome measures related to the gait analysis, posture, and the balance analysis. And to further analyze to further confirm the general screening, the further investigations will be done. One of the further investigations would be the biomechanical analysis. So based on the hypothesis and also based on the general screening findings as well as the further investigations and assessment, the diagnosis would be made. So this diagnosis is very important for a management plan. So the clinician will choose best evidence-based therapeutic interventions according to the diagnosis. So with the time, the reevaluation will be done to see the changes in the condition. It can be a prognosis or it can be a changes in the outcome or the measurement. However, in Sri Lanka, we mainly rely on these two aspects, including the subjective interview and the general screening. However, there are some further investigations, but biomechanical analysis is not widely used in Sri Lankan setup. So if I focus further on the physical examination, the physical examination includes many components. But if I focus on the range of motion assessment and the muscle strength assessment, so these are mainly done in the static position. So this shows how the range of motion assessment is done. So initially, the patients will be asked to move the joint through the available range, and it will be measured. And again, the muscle strength will be assessed in the clinical setting, mainly using the manual muscle testing. The manual muscle testing is subject to the subjective bias because the patient will be asked to do the movement against the resistance of the clinician. So the grading will be based on the resistance given by the clinician and the ability to patient to hold that movement against that resistance. In some clinical setting, they can use handheld dynamometer. Even in research, they mainly use handheld dynamometers to measure the muscle strength. And further, there are some further investigations like nerve conduction studies and invasive electromyography, and also like a simple test like a footprint for the person comes with a foot pathology. And also there are some like validated test measurements like a navicular drop test and the foot touch index and so on. So these are the, and then if you focus on again the outcome measures, one of the outcome measures is the gait analysis. So that can be done in two ways. One is using the semi-subjective analysis technique, and another method is the objective analysis technique. But in some clinics, in a well-resourced clinic, the hybrid system can be used. And the semi-subjective analysis is mainly done by observation. So the clinician will observe the patient walking or the gait, and based on that, the clinician will take some measurements like time, the time duration, or the quality of movement, and so on. So here I have given some examples for the semi-subjective analysis that is commonly used in clinical as well as in the research setting. And then the objective analysis technique can be done in two ways, using non-wearable sensors or using the wearable sensors. Clinical as well as in the research setting, we mainly rely on semi-subjective analysis as well as this image-based method, mainly on video analysis and also using the photogrammetry. So if I focus further on the image-based analysis, mainly the video-based analysis, so that can be done using a mobile device technology. And to further analyze that, there are some validated tools or scales available. So those are called as the gait scales. So to do a mobile-based or mobile device technology gait analysis, we require two systems. So as you can see in the right hand corner, so this is the typical setup we set up in the clinical or in the research setting to gather the data using the camera-based videography. So there should be at least minimum 3-meter walking path, and the patient will be asked to clearly identify walking path, and the camera will be placed in the frontal and the sagittal plane to trace the movement. And there are certain requirements. So in this system, we need good focus as well as good lighting. And then there should be an adequate space to do this analysis and the clothing for optimal visualization. To analyze the gait, the joint, the bony prominence should be visible, especially in the lower limb as well as in the upper limb. And also the skin markers will be placed. The skin marker in the sense like a light colored stickers will be placed over the bony prominence to easily identify the joints during the video analysis. So the clinician can analyze this video itself to get a qualitative data. But in case if the clinician wants some quantitative measurement, then he can go for an app-based analysis. So there are some freely available software. So the Kinovia is widely used. And then to further analyze the gait, there are some gait scales, as I mentioned. So the commonly used are the Edinburgh Visual Gait Scale and also the Observational Gait Scale. So this picture shows the examples of Observational Gait Scale. So as you can see here, we identify different phases, and in each phases, we look at the quality of the movement, and based on the quality of movement, we see whether there is any deviation or whether it's in the normal range. And sometimes there are some scoring system available. So based on the quality of movement in each phases, they give some scoring system. And using that scoring system, they calculate total score. And they use this system to observe the prognosis or the differences before the intervention and after the intervention. And then another example is the Edinburgh Visual Gait Scale. So there are 17 identified phases, and then the gait will be analyzed on each phases, and it will be given a scoring, and based on that scoring, the total score will be calculated. So those are the few examples for the gait analysis. Another outcome measure is the posture and the balance analysis. So usually in the clinical as well as in the research setting, we do take range of motion measurements in a particular posture, and also we use inclinometer. And for the research study purpose, we rely on the image-based processing. So we take the photo of the person in a certain position, and that posture will be analyzed using some mobile-based technology where we measure the range of motion in each particular position. And then the balance will be mainly assessed in a clinical or research setting, some standardized scales or the tool. So the static balance will be analyzed as shown in this picture. We will ask the patient to stand on a different positions, and based on the timing the person is able to hold in that position, the scoring will be given. So that will be used to interpret the balancing ability of that person. Further, there are some scales available for the static and the dynamic. We use a Berg balance scale. So this is widely used even in clinical and also in the research purposes. So there are pre-identified movements. So we ask patients to perform these movements, and based on the movement quality, the scoring will be given, and that will be used to calculate total score. And based on the total score, the balance ability will be calculated. And the dynamic balance test, again, there are some intakes as well as some tests available in the clinical settings. We use these. And also balance questionnaire, where we ask patient itself to score their balance confidence. Based on their balance confidence level, we identify their balancing ability. So this is going to be very subjective. So those are the examples how we assess in low resource or in the absence of sensor, how we assess the posture, balance, as well as the gait. And also, if I focus further on management plan, so usually in a clinical setting, while we are doing a therapeutic intervention, we used to give some feedbacks. So the feedback helps the patient to correct themselves if they have some gait deviation or posture deviation or the movement deviation. But in low resource settings, especially in Sri Lanka, we mainly depend on the mirror therapy or physiotherapy assisted gait rehabilitation or using the verbal feedback. So these are the methods of feedback that we mainly use in the absence of sophisticated instrument or in the clinical settings. So let's see what are the benefits of having a biomechanical analysis or as a further investigations in the clinical reasoning process. So one of the benefits is like unbiased representation of the patient state. So as I mentioned, we mainly depend on the clinical reasoning process. So we depend on the clinician's skills and also the experience to make a diagnosis. So there is always a bias in that assessment. So in order to overcome that, in addition to the general screening, if we could have a biomechanical analysis, that bias system can be eliminated it can be minimized. And then the underlying problem can be detected, especially related to the muscle problem and also related to the force kinetic analysis. And also tiny movements cannot be identified clearly by observation only. So having a system will help us in identifying the underlying problem. And also it's very obvious that will help the clinician to confirm their observations as well as the diagnosis. And then it will quantify the treatment effects. So that's very important because in a clinical setting, we mainly rely on qualitative assessment. Having a system will help us in quantifying the treatment effects. So here I have given an example as a graph. So there we can see that how the gait pattern is different So how it differs between during the treatment or during the intervention. So that will give us how what is the impact that particular intervention or particular surgery have had on that particular patient. So quantifying the treatment effect is very important benefit, and assess some metrics that are hard to assess by only visual inspection. So as I mentioned earlier, the muscles, pressure analysis, and also the kinetic analysis. And the cost of surgical and the other intervention can be minimized. So as in this picture, you can see that the diagnosis can be like facilitated by using the biomechanical analysis. So having an accurate diagnosis will avoid unnecessary surgery and avoid unnecessary intervention plan. So thereby it will reduces the cost related to those interventions. And the cost of care can be reduced by decreasing number of pre and post-operative clinical visits. So that is very much applicable, like when the system becomes very affordable, even that can be installed by the patients, and where the patient use that system by being at home and trace those movements and update the clinicians using the system. So thereby the cost of care can be reduced by reducing the number of visits. So these are the few benefits of having a system, biomechanical analysis system, in addition to the clinical reasoning process. So having said that, it's obvious that there is a need in Sri Lanka. There's a need for a system in Sri Lanka. So that can be further strengthened. So for example, so this diagram shows how the elderly population is increasing with the time. So the aging is one of the aging is one of the factor which is associated with many motor related disorders, as well as the movement disorders and the postural changes. So having a system to diagnose or to identify these deviation will help the better management plan for this population. And also, if I quote some selected evidence from this research or from the studies, so it shows that in Sri Lanka, the clinical NEOA percentage is around 21%. And also, according to the internationally estimated CP incidence, it says that around 2.1 per 1,000 live births are diagnosed to have a cerebral palsy conditions. But there are no statistics available yet in Sri Lanka. But as far as I know, there's a study going on. According to their estimation or according to their hypothesis, they think that this value can higher than the international reported value, because most of the studies were from the developed country. And then another study from a clinical setup from the National Hospital indicates that the Parkinsonism is the commonest movement disorders in the National Hospital. So it shows that how the movement and the gait disorders are common in Sri Lankan setup. And then if I further focus on some of the limitations that we see in the clinical settings, so one of those is the limited resources in terms of funding and also in terms of space. So therefore, it's not feasible and it's not possible to have a sophisticated biomechanical analysis system in all the hospitals. And also the number of patients and the number of staff. So there's a mismatch between the number of patients as well as the number of staff. So therefore, the clinician cannot afford or cannot spend much time with a particular person. So the time constraint is another limitations we see in the clinical setting. And to use some sophisticated instruments, the clinician need to have some specialized training. So that is not widely available in Sri Lanka yet. So therefore, that also coming to the one of the limitation. And then if I focus on the research setting, again, we have there's a high competition for funding. So it might not be feasible to have a funding to establish a sophisticated biomechanical system in most of the research settings. And also the limitation, again, the time limitation is seen in the clinical setting as well, because the limited time of the clinicians and the researchers as well as the patients. So we are not, it's not possible to request a patient to be there for 1.5 hours to do a research study. And also, we mainly rely on some observational data as well as scales and tools to do research findings. So that's again one of the limitations. Not a limitation, but that is what we do. But if we can have a quantitative measures, so our research findings will be further strengthened. So having said that, so it's obvious there's a need for a system in Sri Lanka. So that system should give us an objective measurement, and also it should give us a quantitative measures. It should the system should give us a quantitative measurements, and also it should give us a continuous information. For example, we should be able to use that in a variety of dynamic conditions or variety of dynamic situations. And then the range of environment. So we should be able to use that in a low stress setting, in a clinical setting, as well as in a outdoor setting or in the field itself. And it should be less time consuming because it might not be able to the clinicians as well as patients might not be able to spend much time on doing the data collection using these systems. So therefore we prefer to have a less time consuming system where we can assess the movement as well as pressure and so on. And then it should be user friendly because clinician will not be able to gather the data and then do the calculations and they analyzing the data. So they prefer to have some graphs and some instant measurements in numbers, so that will facilitate them to interpret the data in clinical aspects. So the requirements are it should be portable. It should be portable, preferably. Then it can be used in many research as well as in the clinical setting. And it should be low cost and affordable. In terms of low cost and affordable, I would say at least in a national hospital level or at least in a provincial level hospital, this system should be available. As well as in a private setting, the patient should be able to afford this investigation by themselves. So the cost should be like a minimum or it should be affordable. And it should give us a precise measurement. So that's very important because the clinical reasoning process will be facilitated or will be strengthened using these, can be strengthened using these systems. So therefore, we need to have a precise measurements, and it should give us quantitative measurements. So that's obvious. And also another important part is it should give us a the method should be validated as well as it should be a reliable method. So these are the requirements in the clinical as well as in the research setting. So having said, so with that, I would like to summarize my session. So it's obvious that we in a low resource setting mainly depend on the clinical reasoning process. So mainly depending on the skills as well as the experience of the clinicians, where it can have some bias. So that can be overcome by having a quantitative measurement by using a biomechanical assessment. So that will support the clinical reasoning process, and also it will help in the decision making process and also to identify a more suitable management option. So it's always so it's very obvious that we are in need of having an affordable system, at least in a provincial as well as or at least in the national level hospital, and also in a research settings. So these are a few of my references that I used in my slides. So thank you, and I would like to thank once again for the organizing committee for having me in this session.